All right. So I'm going to talk about understanding the neurobiological basis of addiction and applying it to rational therapies. Sounds very scientific, doesn't it? We'll try to make it understandable. Now, most of what I'm going to talk about comes out of federal research. Let me repeat that. Most of this comes out of federal research. If you don't believe in federal research, I wouldn't have anything to talk about. And I have no disclosures. I'm not on anybody's payroll except Michigan State University. So here's what happens. You say, well, you got to be crazy to take drugs. Not exactly. First thing that happens is voluntary use in search of a hedonic experience. For hedonic, think pleasure. You're looking for a pleasurable experience because either your buddies say, hey, try this, it's really good, or maybe you don't have a job and you can't take care of your family, can't put a new roof on your house, and you're feeling bad, and then maybe you get some pain or musculoskeletal dysfunction and you go to your doc and he gives you something like this. And it helps. And you keep taking it until your physician gets uncomfortable prescribing it, and now you can't stop. And now you're going out and looking for other stuff. So the second thing that happens is loss of control over the behavior. You can't stop. Why can't you stop? Because, as I'll tell you in a minute, your brain gets rewired. These things actually rewire your brain. And then the third thing is then loss of control. So you're now seeking the substance. And then what happens is it really becomes ingrained, and now you got habitual and compulsive behavior. Compulsive because you got to go out and find that drug. Why? Because now it's not making you feel good anymore, but what you're doing is chasing the withdrawal. And withdrawal feels bad. Get yourself addicted and try to withdraw. You won't like it. So how does this work neurobiologically? So the neurobiology of this is there's a little nucleus in your brain called the nucleus accumbens. For whatever pleasurable feelings you have, the nucleus accumbens is the basic mechanism. And the mechanism is that dopamine levels increase in the nucleus accumbens. So you go out and you have a nice dinner, your dopamine levels in your nucleus accumbens go up. You take a drug of abuse, dopamine levels in your nucleus accumbens go up. Somebody gives you a nice gift, et cetera, et cetera. Anytime you have pleasure, you take a cruise. Those dopamine levels go up. So one way that you can do that really easily is by a substance of abuse. It can be opiates, it can be cocaine, it can be nicotine. Nicotine does the same thing. So what causes increase in dopamine? Any drug of abuse. Again, so it's opiates, whatever, and it's also nicotine. So you people who smoke, you got it too. Now, here's a real interesting thing. Look at when people first use drugs of abuse. So it all happens in adolescence, essentially. Every drug of abuse for most people begins in adolescence at some point. So adolescence is a huge risk factor. And here, this is what's called a PET scan, positron emission tomography, and it shows you what areas of the brain light up when you do certain things, when you think, whatever. The point of this slide is the brain is a distributed processing mechanism. So when you do something like speak at a conference, your brain recruits a variety of different areas that get involved in that. And the process of recruiting those areas goes through there's gray matter and white matter. And the white matter in your brain are transmission lines. So that ties everything together. And when you do a variety of things, your brain lights up. So on the top, you got normal. On the bottom, you got somebody who's used alcohol. Look what happens when you use alcohol. Well, many of those areas don't light up anymore. So it shuts down a variety of areas. Alcohol in particular shuts down a lot of your frontal lobes. So a lot of judgment. And that's why people who drink a lot of alcohol get really stupid, because they've just shut down a lot of their thinking mechanisms in the frontal lobe. But this is in general what drugs of abuse do to you. And once it does that, again, it begins rewiring your brain in particular ways. Now, here's the problem with adolescence, and the problem once you use a lot of drugs. If you look on the left, you can see self-control mechanisms. So the frontal lobes, a lot of your frontal lobes exist to inhibit impulses coming up from the rest of the brain. I'd really like to punch that guy. Oh, I better not do that. That'll get me into lots of trouble. That's an inhibitory mechanism. So in a healthy individual with a relatively normal brain, you've got good self-control. And so the drive part of that is not, so intense. Saliency is how apparent to you is that whatever in your environment. You see I'm a guy. So you see a pretty woman, you know, really nice looking. That becomes very salient to you at the time. That becomes an important piece of your life for that moment. And you notice that and less everything else. Now, what happens with drugs of abuse is, on the other side there, saliency. The drug of abuse becomes the important thing in your life once it's established as once it's established as something that you take a lot of. This accounts for why you see, in fact, we had a case conference this morning, and an individual who's now an adolescent, when he was a young infant, he sometimes got fed, sometimes didn't, got placed on the couch because his parents were substance abusers. And you say, well, you got to be crazy not to do that, not to feed your child. Well, if what you're really looking for is the drug, because the drug is the most important salient thing in your environment, you will, in fact, ignore everything else, including your children, including self-care, including a variety of things. That is not anymore a conscious choice. That's a neurobiological phenomenon. Now, why do adolescents? Why does drug use start in adolescence? Because adolescents are set up on the right side of that. For adolescents, frontal lobe control is not so great. Impulses are pretty strong, and so they don't have the same controls that we do. So on the right side of this, you say, oh, my bud said try that? Yeah, I'll try that. Why not? On the left side, where you got better self-control, you say, oh, not such a good idea. Now here's another interesting thing. Here's another neurobiological mechanism. This is a study that was done with opiate abusers. Effects of stress on Iowa gambling task scores, et cetera, et cetera. So what this breaks down to is, if you look at this, look at the things above the line there, at the lines above the line there. So you've got abusers who are short-term abstinent, about under 30 days. And then you've got abusers who are longer-term abstinent, 6 months plus. Now, it turns out if you're an abuser and you've been abstinent 30 days or less, your judgment is terrible, as measured by a variety of things they do in these kinds of tests, these kinds of studies. So if somebody says to you, take some pills or take a drink, well, yeah, I guess, why not? Because your judgment's really bad. If you're abstinent for 6 months or a year, you say, you know, I know what happened to me earlier, I better not. Pretty good judgment. Then what they do is, on the right side, you see those lines descend, they stress people. And they use a terrible procedure where they give them something to memorize that's really long, and then they set up a panel with a bunch of people who look nasty and grumpy and so on, and they say, and then they take away the piece of paper and they say, tell us what that said. And people get nervous, right? So it's a very stressful procedure. After they stress them, they give this gambling task. The gambling task is a card sort. So you turn over cards and you get a reward, or you turn over another card and there's a penalty. And some cards have more rewards than others. If you have good judgment, you begin to turn over the cards that give you more rewards in that pile. What happens after these people are stressed is everybody's judgment goes to hell. If you've been abstinent short-term or long-term, your judgment is terrible. What that tells you is, this is one mechanism for why you've now been abstinent 10 years and you suddenly go back to drinking, or you suddenly go back to using. You say, you know, you idiot, what the hell did you do? Well, the problem is, maybe they've been stressed, and it could be a good stress or a bad stress. So you got divorced, bad stress, or maybe you got a job promotion, good stress. Their judgment goes to hell and they start drinking again. So you got two mechanisms. One is your brain is actually rewired. You go back into the setting where you use drugs and suddenly you get cravings. That's a neurobiological phenomenon. And the second is your judgment can become terrible because of a whole variety of other things. That is not anymore a choice. That is a neurobiological phenomenon. So if you think drug use is a choice, yes, it may be originally a choice, bad circumstances, bad judgment, whatever, but after you've used, you now have really a different brain. And you can go back to using 6 months, 5 months, a year, 10 years. And that accounts for why these things are chronic problems. This is just a micrograph that shows you, these are neurons. That's a healthy neuron on the right side. On the left side, that's a neuron of somebody who's been a drug user. Or perhaps could be a primate who's been a drug user. What you see is there are fewer of those little knobby, spiny processes on that neuron. So it actually changes neurons. So what's the upshot here? One is, Adolescents are particularly vulnerable to substance abuse because of their own different brain structure and neurological vulnerabilities. Second, abstinence abusers will have defects in judgment when they're stressed, and they can go back to using. The neurobiological alterations tend to remit to some extent, but they're always there. And when stressed, these things, become problematic and go back after long periods of abstinence. And so, if you're an abuser, you got to be in treatment for long periods of time, maybe all the time or maybe intermittently. So you say, stress, I better go back into treatment right now. And we have strategies that help. So one is, well, maybe you can improve people's frontal lobe function. You can make their frontal lobes function better, and they can say, my judgment improved, I'm not going to do this. We have some ways to do that. A couple of different types of therapy actually will do that. They're very helpful for a variety of things, not only substance abuse, but things like depression and anxiety disorders. And other things. For example, if you try to addict a primate who's an alpha primate in your troop, it's really hard to do. Lower level primates can get addicted. Higher level primates, it's much more difficult to do because of their position in the social hierarchy, which also changes the neurobiology. So other good strategies, group therapies, family therapies, work with people around their social status, in their family, in groups, at their workplace, and so on and so on. And finally, we have some medications. So naloxone is one that Dr. Neff talked about. We have a variety of others. Buprenorphine is another one. Methadone clinics are a good thing. A variety of these kinds of things. Now, unfortunately, they don't get prescribed enough. So there are lots and lots of treatment centers in the United States, and only about half of them do people come out with medications. And I would add, since I'm a psychiatrist, a lot of these people have comorbid disorders. So a lot of these people have depression, they have anxiety disorders, they have a variety of other things, and you've got to treat the comorbid disorders too. It's not sufficient just to treat the substance abuse. So, summary, we have good ways to treat a lot of these things. We can't be successful with everybody, but we can be more successful than we are, and you got to have the resources to do it. So, for example, if we get rid of Medicaid expansion in this state, a lot of those resources are going to go away. And I think that is it.